Hello everyone. This is our class covering the concepts of prevention for community health nursing. Our goals for today are to analyze the difference between primary, secondary, and tertiary prevention, particularly at the population level. The second goal of our class today is that you'll be able to apply directly the principles of prevention to current case examples that we might find in today's media. And the last goal of our day is to create a brief group presentation that demonstrates the principles of prevention. All of these outcomes are designed to help you meet some of the baccalaureate essentials for nursing education, which we will continue to talk about over the whole semester. Today's agenda is structured as follows. So for 20 minutes, we'll start doing a little mini presentation and lecture, and we'll have a brief discussion period. We'll take a brief poll everywhere flash quiz for about 10 minutes just to make sure everybody's confident in understanding the principles. We'll take a quick break, and then we'll have about an hour to do some small group work, which will require us to go on the internet and work together to find some current public health issues that we can apply to this content. We'll take another break, and then our final hour will be to provide group presentations to the whole class. I do like to give 2 breaks in each class session because we do have such a long class period. You can depend that I will be giving breaks regularly. So the first concept that we're going to discuss is overall the types of prevention. So prevention is an essential feature in today's population health-focused environment of healthcare. It is a global phenomenon. As we become more integrated throughout the world, population health issues, including prevention, become of significance. For example, the World Health Organization just recently released some smoking cessation guidelines, and they're really working globally to eliminate smoking as a major public health issue. I did give you a resource. That's just another different way for you to look at prevention, a little different explanation than what's available in your textbook. It's from the Association of Faculties of Medicine in Canada. You'll also notice that there's a nice table. I would take some time and review the table. It'll just really solidify your understanding of the different types of prevention levels that we're talking about. So, as we move forward, we're going to review the different types of prevention. So the first level is primary prevention. This focuses on absolute risk reduction. Risk is one of the biggest barriers to good population health. So we want to focus on activities and educational opportunities to reduce those risks that cause population health issues. The second principle to really understand with primary prevention is that it is focused on altering behavior and or exposure risks. So for example, asbestos is a known carcinogen, and there has been national legislation and policy created to eliminate the use of asbestos in housing, for example. Primary prevention can be an active activity or a passive activity. When we think of passive primary prevention, it is what our cultural beliefs and value system may influence as far as prevention. And if we think of active, we think of a major public health campaign, for example, in bicycle helmet safety. So as you're reflecting and from your reading, I want you to just reflect for a minute on what you think we are, as nurses, might have as examples of primary prevention. Okay, here's a couple examples of programs that nurses have been involved in pretty heavily. The first one, vaccination programs, probably the most significant prevention process program available globally. Bicycle safety helmet, we mentioned that a little earlier. Lead abatement in homes that have children, and also seatbelt laws. So for example, all of these are good examples of public health initiatives that are focused on primary prevention. For secondary prevention, our whole focus shifts to detection and treatment to control disease progression. Screening programs are the most common element in this level of prevention. It really is focused on early identification, and there are benchmarks of this type of prevention. So for example, colonoscopy is one example of a screening program under the Medicare benefit that does help detect early colon cancer. So for a second, I want you to think about this level of prevention and think about some specific things you may have seen that are secondary prevention. Here's a number of examples of secondary prevention. So the first one, mammograms, recommended by organizations to ensure that women get preventative health early for breast cancer, prostate screening, PSA levels, colonoscopies, stool testing for blood, pap smears. A lot of these are focused on cancer screening, again with the thought that early screening and early detection will help aid in prognosis and possible cure. Preventative health exams are also an example of secondary prevention. Again, identifying an issue early and often is a critical piece to the public health message around secondary prevention. Our third level of prevention is tertiary prevention, and this is a very significant prevention moment for public health when you think specifically about chronic disease. The whole focus of tertiary prevention is to decrease the impact on longevity, function, and the quality of a person's life, to modify risk factors, for example, smoking for someone with lung cancer. Smoking cessation becomes important. And then it may also have a direct positive impact on the overall population prevalence of issues if successful. So other than cardiac rehab programs, can you think of any other tertiary prevention programs that nurses implement? Here's a few. We mentioned smoking cessation programs. That's one of the most significant public health issues in Maine, for example. Cardiac rehabilitation programs, particularly after someone's had cardiac surgery or myocardial infarction. Weight loss programs, we see that pretty consistently with patients who are diagnosed with diabetes, for example, and then multiple disease processes and surgical interventions also require diet and nutrition teaching. Again, the whole goal is to increase longevity and to improve the ability of the patient to have a quality of life. So we'll spend a few moments just discussing any questions that you might have about those three levels, and we'll go forward and we'll do a little quiz. So, if you want to go to pollev.com and there's the extension, or you can use your cell phone and do Valsada 788 to the phone number 37607. Once you get on there, we'll be able to see the results. But we're going to take a little quiz. I have a list of actions that nurses take, programs that nurses are involved in, and we're going to identify whether it's a primary prevention model, a secondary prevention, or a tertiary prevention. Here's our second part. Often patients will ask us questions as nurses, so I put a few statements to help us really focus on which type of prevention we're talking about. and we're going to just have some fun and answer these questions. Let's take a quick break. So for the rest of the class today, we're going to really challenge ourselves to look at global or community health issues that are actually active and present in today's media. So if everybody could pull out their laptops. Our first action item is we're going to split up into small groups of 3 to 4 students. It would be wonderful if you picked students that you don't normally work with, so that you can get a full experience of how this might look in the public health world. Then I'd like you to go onto the internet and do an initial scan of headlines, of Twitter feeds. You can certainly start with the Centers for Disease Control. Would be a great place to start because they usually identify the most pertinent issues in the United States. The same with the World Health Organization website. They have some great efforts going on globally. And just pick 2 or 3 topics that you're interested in. The second thing you're going to do is, using the format that I'm giving you, we're going to identify the key prevention needs, the type of prevention, and how you as a group feel a nurse could actually assist in the prevention effort. I identified with a recent web search a couple areas that are hot topics in the media right now. The first one, the Zika virus out in South America. Flooding and water quality is a huge issue in the Midwest, and our most recent issue with lead in drinking water in Detroit. So in order to complete the presentation in our last hour, what I'd like you to do, I've spelled it out here. I'll leave this up on the board so that you can see it, and make sure that as you're thinking about your work, our goal is to keep it brief, and that you want a 10-minute presentation which summarizes your group's work. Here's a little table if you want a format to set up in. You certainly don't need to use that, but I do want to make sure that everybody identifies where they got their information and what the expert resource was. And grading is always a challenge and interest to students. This is not a highly significant assignment, but I am going to use this rubric so that you understand to put a little bit of effort into this project. So the first area, I really want to make sure everybody's getting the principles of prevention. So if you get all the matches correctly with your topic and the level of prevention, we'll give you a 3. If you miss 1 or 2, we'll give you a 1, and if you didn't match any of the topics correctly, we'll do a 0 on that one. Presentation-wise, easy to follow, a little bit too verbose or hard to follow, and it wasn't complex or it was too hard to follow. And finally, the group process. I'm going to be asking each group how you, and observing whether you engaged in discussions and came up with consensus. A few group members didn't participate, or the last one is you just couldn't pull it together as a group, or one person did all the work. And we really want a collaborative effort here. That's part of the core issues in public health, and we want to make sure that everyone understands how to work together. If you have any questions as you're practicing, I will be walking around the room and giving feedback. I'm happy to help any way I can that way. And the last thing is we're looking for something like a slideshow format, so PowerPoint, Prezi, something that could be visual for your classmates. I have the references here if you want to take a peek at those in preparation for midterm exam. And then again, I have electronic office hours, and we do have a Twitter class feed in case you have any questions after class. After our discussions, feel free to post them. Thank you so much. I hope everybody has fun with this class. I will see you in class, and if you need anything from me, please don't hesitate to ask. Thank you very much.